Today we want to welcome Louisa Dasher-Martin. She is a CRNA and Assistant Program Director at Augusta University. And I'll let you take it from there.
Yeah, so I'm really excited to be here. My name's Louisa. I've been a nurse anesthetist since 2015, been a nurse since 2006. I went to nursing anesthesia school at Northeastern University in Boston, and then a few years later, decided I really wanted to teach, so went back and got my PhD. I finished that in 2022, and I've been teaching full time at Augusta University since 2022. In 2025, so not used to 2026, but last year in 2025, I was named our second assistant program director. And then I practiced one day a week clinically in the operating room. I was there yesterday. I'm kind of strange. I enjoy vascular anesthesia and I like being in the EP lab.
Yeah.
So yeah, I love anesthesia and I'm very passionate about wellness in our profession.
Very good. I think, like I told you before in our just emailing back and forth, that I've been a nurse for over 25 years and I didn't realize how much that this topic actually would impact me and others that I work with. So I think it's just real important that we talk to everybody and let them know, the warning signs, things that they need to look for, because sometimes we just get so busy with ourselves that we put everybody else as a priority and don't even realize what's happening to us and offer resources so that we don't have to pull people back from a place where they don't want to be. We can get it ahead of time. So, can you briefly share your role as a peer assistant
Sure.
ambassador and for the AANA and what this means to you personally?
Sure. So I'll say the wellness committee, I think that our profession does a good job at a number of things, providing a high quality anesthesia to lots of people, lots of all of our patients. But I think our professional organization also does well in the space of wellness compared to other professions, and that the AANA wellness program has been around for a little over 20 years. In 2024, it was 20 years because it was started in 2004. The name of that wellness space within the organization has changed over time. And initially, it was just focused, I think, mainly on peer support for
Mhm.
substance use disorder. But now wellness is more holistic. And while it includes substance use disorder, the AANA Wellness Committee also strives to create a holistic wellness so that all of our providers can have a meaningful and fulfilling career professionally, but also a meaningful and professional personal life because
Yeah.
anesthesia isn't all we do. So the wellness committee, we have charges that we strive to achieve in our year of service, and much of that is the actual tasks that we engage in all go back to our why and what, and that is again to kind of create this holistic wellness, whether that's getting more information out about substance use disorder or getting more information about second victim syndrome. Sometimes we witness tragic things in the operating room, and unfortunately, you're expected, and those impact us.
Mm.
And depending on where you work, you may be expected to move on with your next case and not
Right.
have a time to debrief, right? So there
Yeah.
are resources for that second victim syndrome, which is a very real thing in our profession. We have information on depression and suicidality, on sleep, on creating wellness within the workspace, communication. So I think if you go to AANAwellness.com and click on Get Support, there are links to a number of individual wellness topics, and that's all on the AANA website. So I think we do a good job. I was talking about this with our electrician. It sounds so random, but some recovery from substance use disorder came up, and I was telling him all that, and he knows that about me personally, but I was explaining that I talk a lot about it professionally and what all our profession does, and he was blown away that
Yeah.
there is so much professionally in this space for nurse anesthetists.
Yeah. I never even considered that as part of what the second victim syndrome, as part of what you would have someone to talk to for. It's so true. I mean, there's so much that we almost feel jaded against because we see so much, and then it's like, okay, move on. Like you got another case.
And that can be a symptom of that compassion fatigue and kind of numbness. And, in a way, we have to desensitize ourselves, right? But it's still, I think you can only push something down so much. And when you witness a tragedy in the OR, I know for me, even if it's not, say, a tragedy, but if something goes wrong in a case, in a minute way, I'm like, what could I have done better? Even if it had nothing to do with me as the anesthesia provider. And I feel like a lot of CRNAs, we take on a lot of personal
Sure.
responsibility. Sometimes bad things happen that are completely out of our control and they shape us. Even though we say we're tough, we have thick skin. You
Yeah.
have to have thick skin to work in the OR. I feel like we're all human and you can only push it down and numb so much. And feeling completely depersonalized or desensitized can be a symptom of burnout.
Right. Well,
Um,
I think and everybody who joins this profession is driven. So it's always,
yeah,
well, what can I do better? Where could I have gone wrong? It's not like, pass it off to the next one. That's just the type
right.
of personality that this profession tracks. I think so.
Yeah.
What are the early signs of burnout that CRNAs often ignore or normalize?
So I think being chronically exhausted and feeling no sense of purpose anymore in your work, finding it difficult to complete your work, burnout in the literature, so in scientific literature, is usually measured with the Maslach burnout inventory. It's like the most common way to, if you want to get a population of people to study or a sample to study, you can give them this instrument and have them take the assessment, and it's supposed to be a very reliable predictor of whether or not somebody's experiencing burnout. And there are three different dimensions, and one of those is emotional exhaustion, and that is the one in the literature that nurse anesthetists most often have symptoms of. And again, it's that just feeling emotionally exhausted all the time and taxed, and like you can't keep up with your work. And anyway, I think, maybe not being able to show up for work, having to call in a lot, being physically ill, because eventually it takes a toll on your physical wellness as
Right.
well.
Right.
And I would say too that, I'm much more experienced and much more knowledgeable about substance use disorder than I am about burnout. And I could say that too, though, using things to cope that you say, if you are a drinker or you engage in other recreational drugs, I'm not sure, but you start using them in ways that you don't want to, in an amount more so than you want to, then that could be a red flag. And I think untreated burnout can lead to the misuse of substances.
When it's no longer like, well, just for fun or, have a
Right.
glass of wine. It's at different times of the day or something when you're not even normally used to it.
Right. And it's, one of the hallmarks of problem drinking or substance use disorder is that we start to have consequences, negative
Mhm.
consequences. And despite those consequences, we continue to drink or do drugs and engage in those negative behaviors.
If someone is struggling, but they're worried about jeopardizing their career, like how does going and getting the resources that you need, how does it affect your work in your workplace if you're worried about that?
I would say specifically for substance use disorder, if somebody is afraid, and I s- my husband and I are both in long-term recovery, and so people, and we're not. Maybe some people think we are obnoxiously loud about it, but when appropriate, we disclose that we're sober, right? And we do that to try to end the stigma because so many people still die from this every day, So because of that stigma, a lot of people are afraid to ask for help and they're afraid this is career suicide, right? If I tell you, I think on so many levels. Number one, because we are so driven and the nurse anesthetists are driven, you have to be to get through a nursing anesthesia program and then to survive and thrive in the world of the operating room, right?
Mhm.
So it's like I can't ask for help. I'm a nurse anesthetist,
Right.
I'm perfect when nobody's perfect. So anyway, I think that what I tell other people who I speak with is like, if you don't get help, the career is going to go away anyway.
Anyway, yeah.
Either you're gonna get caught and diverting, or you're gonna get a DUI or have a car accident and kill somebody and get it. There's so many big consequences. The disease is progressive and things just get worse. They don't get better. So the career is gonna go away anyway. And again, I say that to whether I'm talking to a banker or a nurse anesthetist, anybody. If you're worried about people who, say they don't want to go to treatment, I don't want to be away from my children. Well, a lot of times people end up losing their children. They lose custody of their children if things get bad enough. So that's one thing I'll say. The other thing I'll say is that the profession of nursing anesthesia is doing a better job of trying to help nurse anesthetists who have to leave the bedside to go get help, have to leave work to go get help in a treatment center, doing a better job of helping them to be able to re-enter practice. If that's what they decide with their um, with their village of help. If they decide for them that's what's best for them, it is possible to go back to practice. And the AANA Helpline is a 24/7 confidential, so it's completely anonymous source of support for anybody who is thinking they need help or thinking that a colleague needs help. And it's such a wonderful resource that they have. And again, it's answered 24 hours a day, 7 days a week by substance use disorder professionals at Parkdale Center. And it's nobody's going to call the AANA. Nobody's going to call your boss and say, Louisa called last night and said it's
Yeah.
totally confidential. And they can guide you on, yes, it sounds like you need help. Here's what we can do to help you. But
Mhm.
it's not, I would say it's not career suicide, but continuing to engage in maladaptive behaviors, whether it's, you're contemplating, suicide, or you're incredibly burned out and struggling to go to work each day, mentally that will take a toll. And again, eventually physiologically, it'll take a toll. Eventually it will catch up to you. And I believe your career will suffer. Does that make sense? Kind of what I'm,
Absolutely. Yeah. Either
yeah.
way, there's going to be consequences at the end. And, I think if I've seen people intervene early and still return to bedside, I mean, there is a path back to,
Yeah.
working if you want to. Um,
Yeah.
do you have that hotline off the top of
Yes, yes, yeah. I have some resources. So it's 800-654-5167. And again, it's 24 hours a day, 7 days a week. It will be answered by a live person who can, even if you're not the one who needs help, because often the one who needs help, we're kind of the last to get the memo that we need help. But if
Mhm.
you're concerned about a colleague and don't know what to do, you can pick up the phone and call. Part of, Parkdale Center is a partner of in partnership with the AANA, and the AANA Wellness Committee reviews de-identified data from. Um, we get we get information on trends and calls, but again, it's all de-identified, and the bulk of the calls tend to be from people who think others need help. So again, those needing help are a lot of times the last
the
to
last
know.
it's
Yeah,
hard to step forward. I mean, I think
it is.
it's hard to admit it to yourself, let alone admit it to somebody else, especially your coworkers or somebody who's gonna take away your livelihood, that you if that's a fear you have, and I just wanna encourage people to reach out and get help
Yeah.
if you think you need it. Talk to somebody. It doesn't a lot of hospitals and your whole benefit package has an employee assistance program too who can, offer you counseling, and there's lots of resources.
Yeah, I think, for me, I got sober when I was a nurse, but I went to nursing school because I wanted to become a nurse anesthetist.
Mm,
And on the road to becoming a nurse anesthetist, I experienced when I was applying to school, I got two interviews. In the first interview, they essentially said, find another career because of your past.
yeah.
And
Oh,
the other school said, come this way. We think you'll do great. So their stigma is still there.
mhm.
And I believe that for those out there who do need help, there is a community of recovering nurse anesthetists. That's another thing that the AANA Wellness Committee does at all our meetings, at all our big meetings. And at
Yeah.
some of the state level, they have the AIR meetings, Anesthetists in Recovery. So at EDGE coming up next month, the educator meeting, we're going to have an anesthetist in recovery meeting. At annual Congress, at mid-year assembly, we always have those meetings. And for me, was the best thing that ever happened to me, but it was the scariest step I ever
Yeah.
took. But I can't tell you how much a community is important, and a community of supporters. And I think it's scary to ask for help, especially for nurse anesthetists who we like control. We like, you
Mm,
know, we we're very driven, as we talked about.
person that everybody looks up to and
Yes.
go and
Yeah.
help.
We can stay calm in a crisis,
Right.
but I feel like we're also human beings. And the beauty in reaching out and asking for help is that you find out you're not the only one,
Mm,
And
yeah.
we're all human beings. None of us are perfect. We're all fallible. I haven't met a human being yet in my 45 years on the earth who hasn't had some kind of struggle.
Yeah.
And, you know, in the an author I like is Becky Kennedy, and she says perfection is creepy, and I agree. It's not, because it's not real. And
Not
of course,
realistic.
I
Yeah.
struggle with perfectionism, but it's not a real thing. And
Yeah.
when you ask for help, it's like you realize, for me, I know when I asked for help and got help from other people walking the road of recovery who looked like, wow, like she's a mom, she's a professor, she's a nurse anesthetist. It was like, wow, I'm not some monster carrying this thing inside of me. I'm just sick.
Mhm.
And there's a treatment for it.
Yep.
And if she can do it, I can do it.
And I want to speak to the stigma, but that's why we wanted to talk about it this week because we know a lot of people, a lot of CRNAs will be on social media and looking at posts, and we want to break the stigma. We want to talk about it more and let everybody know that there's resources. And I really appreciate you coming on with us and talk
Yeah,
and sharing your story too. That's very personal and we appreciate it.
of
Okay.
course. Thank
Right.
you for having me on.
All right. Thank you.